وفي أنفسكم أفلا تبصرون.
Symptomatology in psychiatry. Composition of mind. Intellect, affect, behavior. Intellect. It includes the process of thought, perception, orientation, memory, attention and concentration,
judgment, insight, general knowledge, intelligence. Affect. The emotional tone a person expresses. Behavior.
Whether due to trauma from a car accident or a disease such as unmanaged diabetes, if you work in the medical field, you'll come across scenarios where people will have altered levels of consciousness. A level of consciousness, LOC, is the degree of a patient's cognitive function. Consciousness is the state of being awake, aware, alert, and responsive, while unconsciousness is the state of being unaware and unresponsive to stimuli. But in between consciousness and unconsciousness, there are many other levels of consciousness. Let's start with confusion. Confusion is a disturbed orientation with respect to time, place, or person. It's a state of mind that causes disorientation, bewilderment, poor decision-making, and difficulty following commands. Confusion can come from drug abuse, a fever, or even sleep deprivation, among other reasons. Confusion is a part of delirium, a sudden and typically fluctuating and reversible condition marked by hyper-alertness one moment and confusion, sluggishness, and disorientation the next. Delirium can result from everything from intoxication to surgery, especially in elderly patients. Another LOC is lethargy, a level of consciousness marked by drowsiness, listlessness, apathy, and a small reduction in alertness.
Behavior. Behavior. General overactivity, hypokinesis, repetitive activities, impulsive action, others types. General overactivity, mild as in agitation, excess overactivity which is usually unproductive and restlessness. B. Severe as in excitement, is severe form of hyperactivity patient may destruct himself. C. Restlessness, inability to sit. Pacing. Rooming back and front on feet. Crossing and uncrossing legs. Inability to relax. Two. General reduction in activity, hypokinesis. Entail complete inactivity and incontinence. Three. Repetitive. Stereotype. Mannerism. Perseveration. Negativism. Automatic obedience. A. Stereotype. Monotonous repetition of movement without purpose. B. Mannerism.
Monotonous repetition of movement without purpose, but last for hours or days. C. Preservation.
Repetition of a recent act may be an movement, phrase, word, D. Negativism. Automatic resistance to all stimuli. Muscular as keeping arm extended. Speech as mutism. Retention of urine and feces. E. Automatic obedience. Automatic following of suggestions. Ecopraxia, repetition of action seen. Waxy flexibility, as if made of wax. Catalepsy, bizarre posture for long time. Compulsion, is repetitive and stereotype is purposeful behavior. 4. Impulsive action. Sudden unplanned activity such as attacking another person. 5. Other types. Aggressive. Acting out. Manipulative. Regressive. Akathisia. Ataxia. Thoughts. Divided into form, stream, content. Types of form. A. Concrete thinking. B. Autistic thinking. Pressure talk. The speech is increased in both quantity and rate and is difficult to interrupt. Circumstantiality. Speech indicates slowed thinking incorporating unnecessary tribal details. The goal of thought is finally, but slowly reached. Flight of ideas. Rapid jumping from one idea to another. Tangentiality. An association disturbance in which the speaker goes on the topic, when it happens frequently and the speaker does not return to the topic. Blocking. Sudden stoppage of the stream of talk. Poverty of speech. Speech that is brief and uncommunicative. Clang association. The meaningless rhyming of words. Retardation. It is slow speech. Looseness of association. Connections in thought are interrupted. Neologism. Words and phrases that have no meaning for the patient himself. Incoherent talk. A mixture of words and phrases that have no meaning. Irrelevant type of answer. Answer is not harmony with question-answer. Preservation. Psychopathological repetition of the same words or idea in response to different questions. Echolalia. Repeating the speech of another person. Palaia. It is pathological repetition of the last word said. Types of content. Delusion. Obsession. Preoccupation.
So people with delusions have these unusual beliefs that are clearly false, but they hold firmly to this notion that the belief is actually true. Various mental disorders, including schizophrenia and schizoaffective disorder, involve patients with delusions of some kind. Although a lot of times these patients will present with other symptoms of psychosis, like hallucinations. Delusional disorder, on the other hand, is characterized by someone having just persistent delusions. Now, every delusion someone has can either be considered non-bizarre or bizarre. And non-bizarre delusions are plausible, meaning that whatever their belief is actually possible, but it's incorrect. An example of a non-bizarre delusion could be thinking that you're constantly being followed by someone, or thinking that you have an infection when you really don't. A bizarre delusion is one that's clearly not possible. A classic example would be thinking that someone has removed all your internal organs without leaving any sign of it, or leaving a scar of some kind, and really sticking to this. It's clearly not possible that the organs are missing without leaving some kind of trace of removal, right? So delusional disorder involves a delusion of some kind, either bizarre or non-bizarre, without any other symptoms of psychosis like hallucinations, disorganized thoughts and behavior, or other mood disorder symptoms like mania or depression. It's only delusions. Now, another big difference here between delusional disorder and other psychotic disorders, like schizophrenia, is that despite these delusions, the person's able to otherwise function pretty normally in many areas of their life, like socially, or in relationships, or at work. Now, there's this whole list of subtypes of delusions that are usually associated with either non-bizarre or bizarre delusions, though these subtypes aren't always just in one or the other. Now, to kind of get started, delusions of control are delusions that somebody is controlling their thoughts or behavior. Like, for example, thinking that they're being controlled by aliens. And these are usually bizarre, as being controlled by someone is considered not quite plausible. Nihilistic delusions are these ideas around the non-existence of themselves, or of parts of themselves, or even the world. So they might hold on to the belief that meteorites are going to destroy the Earth and that the world is actually ending. And delusions of thought broadcasting are where the patient thinks that their thoughts are being broadcasted for everyone to listen to. Delusions of thought withdrawal, on the other hand, is thinking that some of your thoughts have been taken out of your mind and that you have no control over this. And these are all really considered bizarre delusions, usually, but they don't necessarily have to be. And some of the other types of delusions that are considered non-bizarre and could potentially be possible are ones like persecutory delusions, which are actually the most common type of delusions. And these involve the theme of someone being followed or cheated or conspired against. An example of this could be thinking that the government's following them because the government incorrectly thinks that they're actually a spy. Delusional jealousy, or sometimes called delusions of infidelity, is this firm belief that your spouse or significant other is having an affair. Delusional guilt or sin is this belief that you're guilty of some crime and should be punished severely. An example of this could be thinking that they're responsible for some catastrophe, like a house fire or something, when they clearly weren't. Delusions of reference are thoughts that some sort of remark or event or broadcast is directed at them or has some sort of special significance, like thinking that the news anchor on television is actually trying to communicate directly with them. Somatic delusions are delusions that have to do with bodily functions or physical appearance, usually something to do with their body being diseased or changed in some way. So it could be thinking that your body is infested with parasites. Erotomania is this delusion that another person, usually like a celebrity, is in love with them. Grandiose delusions are those where the person exaggerates themselves and thinks that they have these special talents or abilities. And finally, religious delusions are any delusions with a spiritual aspect. Although it's important to remember that beliefs that are in line with the person's culture aren't considered delusions. And furthermore, any of these delusions that have been mentioned might be mixed with each other as well. Okay, so just like many other types of mental disorders, the cause of developing these delusions is essentially unknown, and research has been pretty difficult because many people with delusional disorder don't seek out treatment or diagnosis, and also because the definition of delusional disorder has evolved over time. Currently, though, from the Diagnostic and Statistical Manual for Mental Disorders, the 5th edition, or the DSM-5, the following criteria are given for delusional disorder. The delusions must have been present for longer than 1 month, and they aren't accompanied by any other psychotic symptoms like hallucinations, disorganized speech or movements, or negative symptoms like flat affect. Also, functioning hasn't been affected, except where it relates to the particular delusion, like for example if you avoided opening your mail because you thought the post office was trying to poison you. Finally, other causes of the delusions have been ruled out, like medical conditions or other psychiatric disorders. As to the treatment, this can be challenging. People with delusions often deny any problems or that there is anything wrong with their beliefs. So sometimes antipsychotic medications might be prescribed to reduce the delusions, but also psychotherapy can be a very effective treatment. Finally, the prognosis for delusional disorder is usually pretty good, considering that most of the delusions don't significantly impair their daily life. Some patients, though, might get more involved with their delusions and could risk further dysfunction or risk harming themselves or others.